If you removed your tooth and then you felt too much pain after 2 or 3 days, watch this video. This video is for you. How are you, everyone? My name is Imi from Hope Smiles Dental Clinic, and today I want to talk about what we call a dry socket. What is a dry socket? A dry socket happens after a tooth extraction when a blood clot doesn't form. But when this clot is gone, it exposes the nerves and the bone, and then the pain is intense. How do you know that you have a dry socket? One, you will have a lot of pain 2 or 3 days after the extraction, and this pain does not respond to any painkillers or any antibiotics. No matter how much you take the medicine, the pain will not respond to this medicine. Second, you'll have a bad smell from your mouth or from that side where the tooth was removed. Third, you will feel like you have a bad taste in your mouth. You feel like everything you eat doesn't taste right. And you can also get pain that goes up to the ear, up to the neck and the back of your head. This pain is too intense and it does not respond to any kind of medicine unless you see a dentist. For some of the patients we've talked to, they've told us that this pain is actually more than the pain of a toothache. Let's talk about what causes a dry socket. One, not following the doctor's instructions. So some of the patients come and after removing a tooth, the doctor is going to tell you, swallow your saliva, do not spit. And because you feel like your saliva is thick, you keep on spitting. So the more you spit, the more you pull the blood out. Remember, the saliva is thick, so we're going to keep pulling the blood out, and the blood is going to keep coming, and it will not form a clot, and this clot is the one that aids us in healing that wound where we've extracted the tooth. Number two, you are not supposed to touch your wound with fingers, because our fingers are always dirty. You all understand that even if you just washed your hands, 30 minutes later or 10 minutes later, when you go and wash your hands again, you see that they're still dirty. So our fingers are always dirty. Putting your fingers in the wound means you're going to infect the wound, and it is going to cause a dry socket. Number three, smoking after the extraction. Smoking can also cause a dry socket, and that is why we always tell our patients, if we have removed your tooth, do not smoke until the wound is healed. Another reason is rinsing with warm water that day that we did the extraction. When we give instructions after the extraction, we tell you, do not rinse today, you rinse the next day. So some patients reach home, boil some water, let it cool a little bit, add some salt and rinse in the mouth. And this removes the other clot. Remember, the other clot that was forming to aid in the healing of the wound. It's going to come out because of the rinsing. So you are not supposed to rinse that exact day. Using a straw after an extraction, we do not recommend that. We actually advise that you use a cup or a glass when you're drinking anything after removing your tooth. And then poor oral hygiene. If you do not take good care of your mouth, if you spend 3 days without brushing after an extraction, it can still cause the food that you eat to go in the wound and infect it. So you have to brush gently. You make sure you don't move your toothbrush into the wound, but you brush the rest of the mouth. Like I said, spitting is not advisable. You do not spit the saliva after the extraction. You bite on the cotton for an hour, then when you remove it, you do not keep spitting. Just keep on swallowing the saliva and swallow your medicine. That is going to help you avoid a dry socket. So yes, we've talked about what causes it, and now we're going to talk about how to prevent it. How to prevent it: number one, follow the doctor's instructions after the extraction. Listen to what the doctor has told you, not what you know off your mind. So one, do not spit after the extraction. Do not use a straw, okay? Do not rinse that same day. You do not eat food that has had stones or crystals that are going to go into the wound, okay? You do not smoke until the wound is completely healed. In fact, smoking should not be part of our routine. We're not supposed to smoke because smoking stains your teeth. We all know that. So you do not smoke, you do not drink alcohol during those days that you're treating your wound, okay? And you also keep a good oral hygiene. You take your medicine the way the doctor has prescribed it. If it says take 3 times a day, take your medicine 3 times a day, because at the end of the day, the pain will be on you. And like I said, the pain of a dry socket is actually 3 times more than a toothache. If you have a lot of pain, or if you know someone who has gotten a lot of pain after the extraction, do not ignore the pain and do not treat it at home, because home remedies are not going to help with a dry socket. The only thing that can help is seeing the dentist immediately. At Hope Smiles Dental Clinic, we always make sure that we give the patients the right instructions after removing their tooth. But still, if something goes wrong and you feel like you're having a lot of pain, visit Hope Smiles and we're going to help you on how you can take care of this condition so that you can get out of this pain and you get fine. We are here to always make sure you do not have any pain, you are smiling, and you are happy. You can book an appointment with us and you consult about anything that is bothering you, anything related to your teeth, anything related to your dental problems. Just talk to us. We are either on WhatsApp or on call. I'll put our numbers down in case you want to talk to us. Talk to us anytime. You can send us a WhatsApp message anytime and we are always on WhatsApp. We shall always respond to you. Thank you for listening. Have a lovely day. Bye bye.